Hello, Vetfolio Voice listeners. I am so excited to bring you this podcast where I had the privilege of speaking to the wonderful guys from a little podcast called Vet Tech Cafe. If in your podcast surfing, is that what you do when it comes to podcasts? Man, I feel old. It just occurred to me that I'm the host of a podcast channel, yet apparently sorely lacking when it comes to correct terminology. But anyway, I digress. If you have not checked out Vet Tech Cafe, I highly encourage you to scoot, surf, click, whatever it is you have to do over to their channel and check it out. Dave and Jeff interview veterinary technicians and nurses in all aspects of the veterinary field, including those in clinical medicine and those forging careers outside of the clinic. They discuss different medical topics as well as diving into some of the hard-hitting issues facing veterinary medicine today. The next time you have a few minutes, it's well worth the listen. If you don't know who they are already, let me tell you a little bit about Dave and Jeff, and then we'll get into our talk. Dave Cowan graduated from UMass Amherst in 1995. After moving to New Hampshire, over the span of 20 years, he worked for an educational farm, the Animal Rescue League, a general practice, and an emergency practice. In 2013, Dave passed the Academy of Veterinary Emergency and Critical Care Technician exam and became a veterinary technician specialist in emergency and critical care. In 2016, Dave moved to North Carolina to become a technician supervisor at the Veterinary Specialty Hospital. Dave joined the Triangle Veterinary Referral Hospital to become their education and training coordinator in 2018. He now teaches at Millermont College in Raleigh while still working relief shifts at emergency and referral hospitals. He has a passion for emergency medicine and is a certified recover instructor. Jeffrey Backus started as a veterinary assistant in general practice in 1995. He began working in emergency and critical care in 2004. He became an RVT in 2009 and was an ER ICU supervisor at Animal Urgent Care for over 12 years. Jeffrey also taught part-time at his alma mater, Heritage College, for 7 years. In 2013, he became credentialed as a VTS in emergency and critical care and sat on the credentialing board's exam committee for 3 years. He's now the co-chair of the credentialing committee. He's been on the board of directors for the California RVT Association for 8 years, currently serving as president, and has been a subject matter expert for the California Veterinary Medical Board. In 2016, he moved to Massachusetts to join academia, working as an ECC technician at the Tufts Cummings School of Veterinary Medicine. He's also a frequent lecturer and speaker on all topics related to emergency and critical care. So, as you can tell, they're kind of a big deal, and I was thrilled to have the chance to sit down with them over a cup of coffee and discuss some of the difficult issues facing veterinary nurses and technicians, and how we can work together from all aspects of the profession to help create long-term sustainability in the veterinary field. Let's jump in. All right, we're so excited to be talking today to Jeff and Dave from Vet Tech Cafe. Thank you guys so much for agreeing to do this podcast together.
Oh, we're happy to be here.
Yeah, absolutely. Thanks for inviting us. This is going to be so much fun.
Yes, absolutely. I've been looking forward to it.
Yeah, for sure. Well, what do you think? Should we just get started and go right in?
Absolutely.
All right. So I think what we're going to talk a lot about today is just a lot of the issues that our profession is facing. And what do you think? Where do you guys want to start off with? Maybe technician utilization?
I think that's a good point. A good starting point.
All right.
I recently had somebody correct me when I said technician utilization. And they said, you utilize your pulse ox. You don't utilize people. You empower technicians.
Okay.
What's your feeling on that?
I'd never heard of that. That does make sense, but I think we hear that term and we use that a lot of technician utilization and kind of what it means to me is using us as valuable members of the team and speaking personally from when I was a young baby tech, very early on, 20 years ago, we were just glorified warm bodies that would hold animals for the doctors. And, it wasn't until after a group of the technicians said, there's stuff that we can do. And our doctors started to say, okay, this is how you intubate. And this is the other things that you can do as technicians. And it took us actually going to our doctors and saying, why are we just sitting there holding animals for you to do stuff to? We should be more involved. And I think that's kind of just the very beginning stages of things. And as things have progressed, here we are 20 years later, and we're still looking for that validation of what we can actually do. I will say it's better, but we still have some work to do.
Yeah, I agree. And I think, utilization, yes, I love the idea of empowering your technicians, but I think the utilization comes from utilizing their skills and knowledge, not,
Sure.
not just utilizing, the person to do tasks or whatever. And, the amount of training or the amount of education that they may have obviously is highly variable, but the utilization to me comes from, being able to perform tasks, or whether it be talking to clients or doing procedures or whatever it may be, to free up the veterinarian to do things that really by law they are the only ones in the practice allowed to do. And so, when you look at, I come from California, where our practice act is I'll say pretty rigid. It's pretty explicit what can and cannot be done, and really there's 4 things that only a veterinarian can do, which is, surgery, which is pretty well defined, diagnose, prognose, and prescribe medications. Outside of that, it's the comfort level of who you have around you, and what trust you have in them and their ability to do all of these things to free you up to be able to see more people, or, do the things that we cannot do. And so, utilization really becomes a 2-way street. By utilizing us, then you can utilize the skills that only you can perform, or a veterinarian can perform in a practice.
Sure. Plus something to be said with kind of this universal terminology that we've used for a long time, that it has kind of a familiar meaning to a lot of people. And I like what you said about the 4 things that only veterinarians can do. I think it's really important that we continue to remind people of that a credentialed technician, obviously it varies state to state, but really can legally do a lot of things that I think sometimes that we forget, that as veterinarians, I think it's pretty universal, even with the variations state to state. The 4 things that are limited to only veterinarians are exactly what you said: diagnosing, prognosing, surgery, and prescribing. And then we really need to let off the reins and let the people around us do what they're trained to do and what they love to do.
Yeah.
Well, not to go down a rabbit hole so early, but
That's what we're here to do.
Yeah.
Jeff brings up a good point of there are so many varying levels of education and skills and knowledge amongst the team members, not just doctors, but also with technicians and technically assistants or what have you. And it must be frustrating for doctors to come into a practice that you don't really know the team all that well, and you do have that big varying level of skills within that practice, and not knowing, like, what can you do, like what do you know how to do, because there
Right.
are so many things or so many different levels of people that I don't want to say that are allowed to work in the field as technicians, but there's such a varying level of skill level and experience level and knowledge level to say, okay, I'm going to come in. This dog needs a central line. Which of my 12 technicians can do that, and which of you 12 are actually technicians that are trained at that? And you may have somebody that performs the functions of a technician, that can draw blood, that can run blood work, um, can run a urine sample, even obtain a urine sample. But then there is that also other part of that where some of those more advanced skills, you don't know who's even able to do that based on, like, is this the first time you're ever placing a central line? Do we need this right now? Or do we have some time to like train you to do this on the fly? And I think that varying level of education and knowledge and experience is very difficult to manage as a doctor, kind of going through these things and trying to figure out who can actually do these things.
I think you make a good point, and I appreciate you letting us as DVMs off the hook a little bit there, because working as a relief vet, as I have for the last year or so, a couple years, You're right. There is a huge variation in the skill levels of the people that you're working with. And so as much as it is important to make sure that we're allowing the people around us to do what they are able to do, you do sometimes have to go in there with, feeling like, okay, if something can't if there's nobody in here with this skill level to do this, then it's going to fall back to me. And so that can make it hard to let go and say, okay, I'm going to let you go ahead and do this, if you don't have that comfort level with the team to say, okay, I know who knows how to do what and what that comfort level is, what that
Right.
skill level is.
Yeah, yeah. And I think for me as well, and we've talked a little bit about this on our show a couple of different times, that, I think some of this goes back to how veterinarians are trained in school. So I just finished up 4 years working in academia, and I, I'll say, there are some departments better than others that are good at utilizing technicians, some not so much. But I was kind of surprised at how little a vet school functions like an animal hospital that a veterinarian is going to work at when they leave school. There are a lot of students, or actually, I guess really all students, are essentially utilized in a way of free labor for a lot of things, for patient treatments, for what have you. And I think that a great time to actually train veterinarians on how to utilize the staff is when they're in school. And I think we're missing the boat there by and large, based on, again, just my experience in academia and a couple other people I've talked to as well, that we almost aren't training them to be ready to go into a hospital and know the roles of all the different people that are there and the functions that those people in those roles can do, what it means to be a credentialed technician and what the difference is. And I think in a really substantial way, we're kind of missing the boat there, in a way, again, to the whole point of veterinarians going to vet school, right, is training and learning and knowledge. And I think we're missing a huge section of that. And it's kind of inadvertent, not that we have to have classes about, how to function in an animal hospital, but if the vet school, the teaching hospital itself, were to function more as an actual practice would, and not have the student do all of these things that receptionists would do or client service representatives would do, like answer the phones or do patient treatments like technicians normally do, and actually kind of just set the example of how it should be. I think that could really, really go a long way. But as technicians, how do we work on that, or how do we fix that? That unfortunately has to be done by the AVMA, and we don't have a seat at the table. So, but I think that's one area where we can really make some substantial improvements, and that would naturally, again, kind of over time, really help solve some of that problem.
Yeah, absolutely. Of just learning what the different roles are in the hospital. I think the intention behind having students do a lot of these things is good. To give DVMs a familiarity with the different roles throughout the hospital. But you're right; it might put us a little bit into that mentality of, I have to do all of these things. It's
Right.
all my responsibility. Versus, it's a good idea to understand the different roles, but as part of that understanding, um, figuring out how you work as a team and how you rely on each other, and everybody gets to play a role in the practice.
Right. Yeah.
I do somewhat agree with the way the schools are running now. Is, Jeff, you say we should be treating these animal hospitals like we would normally do that in school, and utilizing technicians and utilizing credentialed technicians. However, there are practices out there that don't have RVTs, they don't have LVTs. So I do kind of understand why doctors need to get training on some of those things, because like you said, Cassie, there may be times where you get into a practice and you're the only one that knows how to do that one thing. So I do somewhat understand having doctors learn that stuff. However, if they didn't have to, they could spend so much time learning other things that are more important.
Right. And I think that's it, is learning the value of having those people and having those people on staff, and it feeds into so much other things, or so many other things that we're going to talk about today. All of these topics are all kind of intertwined, and there's I think it's a multifaceted problem with lots of probably very complicated solutions.
Yeah.
That's okay. We're going to solve it right here.
Oh, we're solving it today. Awesome.
Yes. Yes.
But I mean, we've always said, you can't start to fix a problem if you don't start talking about it. So just starting to talk about it, I think hopefully we'll, I don't know how our reach is not huge. We don't have a massive reach, but we do have some reach, and you have some reach. So hopefully we can reach out to some people and maybe get people talking about this and getting more change involved.
Yeah, I think we need to talk about it, and we need to keep talking about it, because I think there are some real issues here, just as illustrated by our exchange up to this point of different ideas. And yeah, these are major issues that we need to address. I mean, we have problems with longevity in the field, and burnout, stress, et cetera, et cetera, et cetera. So like you said, the first step is to start talking about it and have people understand where these problems lie, and let's start brainstorming, and just because it's always been a certain way doesn't mean it has to stay that way.
Right.
We always say just because that's the way you've always done it doesn't mean that it was always right.
Yes.
Right.
Yes.
That a lot.
Yeah. Or I mean, you should change and adapt and improve as new things come out, and knowledge is gained and so on.
We do that in medicine, right? I mean,
Right.
we change and adapt. So this is part of medicine, is you change and adapt to the culture as well.
Right. Absolutely. Yeah. Kind of thinking about this again as like a multifaceted problem, one of the things that also kind of goes in there too is pay. And, it's pretty well established. I think both professions, the technician profession and the veterinarian profession, are largely underpaid, and certainly better in some areas than others. But again, I think if you have, well-educated and well-trained staff members, veterinarians, associate veterinarians, whoever it may be in the practice, they need to be adequately compensated. But a term I hear a lot these days is living wage. And to be honest, I don't even honestly know if I know a definition of a living wage. It almost to me in some ways kind of sounds like a buzzword, because what a living wage where I am now in Rhode Island versus where I'll be in Southern California in 2 weeks are two very different numbers. Very different numbers. And so, but then again, we talked, Dave, you kind of mentioned a little bit about the almost kind of alluded to like a technician shortage, where there might be areas where veterinarians don't have an RVT or something on staff. If we make this a sustainable career financially, will that help alleviate that problem? I think the answer is yes, but again, how do we get there?
Right.
And I'm really interested to hear just where you guys fall on this and your thoughts on it. Because of course, on the DVM side, we have our own set of financial issues. From what I personally have encountered, and I know finances are a sensitive topic, so I am by no means speaking for everyone, but for me personally, I've struggled more with interest rates on student loans, making them nearly impossible to pay back, rather than the wage themselves. So the wages themselves, I think, are livable, let's say, that living wage, we'll use that buzzword, in a lot of cases, but not when there's this huge student loan burden with really high interest rates to try to pay back. So I think there's a difference. And again, like I said, I know this is a sensitive topic, so I definitely want to specify I'm speaking, just from personal experience. But I think there's a difference between DVMs and technicians when it comes to the financial side of things. So I'm really interested to hear your thoughts and how this is how it affects you.
Yeah. I guess I would say, so I'm 25 years in clinical medicine. I felt like in terms of, and hold a VTS credential. And I felt like in terms of clinics, whatever market I happen to be in, I'm probably at the top of the wage earning scale in clinical medicine. So and thankfully, again, I started long enough ago. I think I was actually trying to remember the other day for this particular recording. I think my starting wage in this field was $5 an hour.
Oh my goodness.
And of course, that was 25 years ago. But then I was thinking where I am now. I don't even know if that's not even $1 per hour a year increase.
Right.
And so, yeah, it's still, a long ways to go. And Dr. Cassi, I can kind of relate to your point as well. My wife is a veterinarian. She just graduated. She was a V18. And so, again, being a sensitive topic, but I'm going to throw some numbers out. She graduated vet school, $350,000 in student debt.
Oh my goodness.
And then she did a 1-year rotating internship that paid her, I think, $35,000 for the year. And I don't know if you did an internship, but anybody that's listening that certainly has, you understand it was probably 60 to 80 hour work weeks. So she was making probably single dollars per hour if you actually calculated that out. And then of course the stress of a really crazy busy referral practice and trying to figure out how to do medicine and all of those things. It like 1 year in, she's already wondering if it's all going to be worth it, and then she did a second level internship for her second year. And so it's, the burden, and I'm only kind of experiencing it secondhand, but for graduating veterinarians, I cannot comprehend some of those numbers. And I mean, I'm staring at the papers and I still can't comprehend it. So, it's again, a multifaceted problem. And I don't know how to make vet school less expensive. I don't know how to magically, increase pay, but that is a massive disparity.
Right. Yeah. Right. Yeah. And I did not do an internship, and not the entire decision, but there was definitely a part of that was a financial decision for me, to know that I was going to be going another year, 2 years, wherever that took me, with a lower, such a low wage in comparison, probably, half.
Right.
And what that was going to do to my student loans, although, in hindsight, I don't know that I made a huge dent in them anyway. But yeah, part of my decision at the time was a financial decision.
Yeah, absolutely. I know many of her classmates, friends of ours that made the exact same decision, just to go out into practice because they thought they could get the same training and mentorship that way and not go through the burdens of an internship. And I completely understand.
Mm-hmm.
Yeah. And Jeff, I'm kind of in the same spot. I think my first veterinary job, I was making maybe $8 an hour. But still, obviously 20 some odd years ago. And I would say that I'm also at that point where I've probably maxed out what I'm ever going to make as a technician. And I've been thinking about this a lot because, as I progressed as a technician, as I got better and I passed the VTNE and passed my VTS boards and gained all these skills and took on all these new roles and all these other jobs within the practice. I think, where I was up in New Hampshire, my longevity in that practice, like I was in that practice for a good 10 plus years. And I think that's probably a big portion of why I got to the level where I've made. And in the last 4.5 years since I moved down here, I've changed jobs roughly 3 times. I'm about to change jobs a 4th time. Spoiler alert. This will probably post after that's announced. So,
do they know that?
they don't yet, but I mean, some people do, but
sure.
not my students. But I've changed jobs roughly almost every other year as a technician down here, and I have not made any more money. My pay has been pretty much the same since I left New Hampshire 4.5 years ago. Like I have not made a cent more. I'm actually making less right now. So, there is a cap to what we can make. And, unfortunately for me, I hit that cap 5 years ago. And I'm left wondering, like, I'm at the point where some other younger technicians are making, $10, $11 an hour, thinking, am I ever going to make more money? And I'm at that same boat, even though I'm making way more than that. And not to say, using this term livable wage, yeah, I have more responsibilities now. I have more costs now. I have more certifications that I need to keep up with now because I've advanced myself that far. So yeah, the money is a big thing, and I can't speak to the point of some of the other technicians because Jeff and I are kind of at the top of what we will make. But there's, I mean, younger technicians, newer technicians. I can't tell you how many of them are working two jobs right now,
Mhm.
and they're making that livable wage by combining sometimes two full-time jobs together just to make it and to pay rent and buy food and afford car insurance and all this other stuff. And it's to the point where, yeah, this job there's no wonder there's so much turnover because it's not
Yeah,
sustainable.
it's not sustainable. Yeah.
Yeah, I'm nodding my head going, I've seen it firsthand. I lived it for a period of time. I worked as a technician, technically an assistant. I say technician because I'm in Florida, where credentialing is not required. But so technically I was an assistant at the University of Florida for a while. And, I saw it so much as far as not being sustainable in the long term. And my husband still sees it. He does human resources over there, and we try to solve this problem on a regular basis, and we still haven't
Yeah.
gotten to the bottom of it. But I think these are a lot of the major issues: the utilization, the pay, and then you guys also mentioned staff turnover being a
Mhm.
big issue. I
Yeah.
know that's a huge source of frustration from a veterinarian's perspective. And I know it is from yours as well. I always look at it, I rely heavily on my team when I'm in the clinic. I always feel like I'm just one person and I'm only human. I'm so fortunate to have this team of people here to support me. And I can't tell you how many times, I'm just kind of like steeled against it because you get that team that you trust and y'all, everybody's in support of each other. But due to that lack of sustainability, all of a sudden you lose one person or you lose more. And people are forced to pick up additional responsibilities, which leads to that stress. And there's still the pay issue. And, here we go through this roller coaster that happens over and over and
Mhm.
over again. And it's, I get it. It's frustrating, but I get it.
Yeah.
Yeah.
I would say, I think, you know, again, not to make light of the first two issues that we talked about, but I think if ever we as a profession were to get the utilization and the pay figured out, the turnover would naturally
Hmm.
work itself out. Like, I think this is one that I don't know that we can solve without solving some of the other things. But I will say too, in my time at Tufts, we, like, students turnover every year. It's a new set of students on clinics. It's a new class of interns. There's always residents coming and going every year. Other than faculty, we don't have staff doctors. And so turnover is just such a natural part of the environment. And I don't know if it's that spills over to technicians. I also know that, our vet school and probably several others promote assistants to the title of veterinary technician that aren't credentialed. And that's administration. That's fundamental, right? That's not on the students or the faculty or anything like that. But when we get back to like turnover and stuff, I felt like where I was, turnover was just such a natural thing because everybody in the hospital was doing that. I almost felt like there was no uh, desire to keep long tenured or well educated or well credentialed staff because turnover was just such a natural thing.
Hmm.
And when I started there, I was a group of a couple of different technicians that were hired specifically for the emergency and critical care department. And while I don't have the numbers, I strongly feel like when I left, which my last shift was just a couple weeks ago, we were at a net loss of people from where I started 4 years ago. I mean, we had 6 or 8 open positions when I
Wow.
gave my notice. And we just, there's a couple people that we've hired that have stayed, but there's not, there's already so many people that have come in, and we have a really, really great tech school program nearby. That's still one of the few tech programs that has a fully functioning animal hospital. Um, on site. So they get a lot of in-hospital training, these veterinary technician students, and we get a lot of employees from them. And just in my time alone, I know technicians that graduated from that program, got their CVT, and left, and not just left academia, they left veterinary medicine altogether because within a year or two, they were already like, this is not sustainable. I can't do this, and have moved on to find other careers. And when I think back younger in my career, turnover wasn't nearly the thing, at least in the clinics that I worked in. Dave, maybe you can talk to that too. But I think now people are just less willing to put up with the BS and the poor conditions and the low wages and the lack of utilization and stuff that maybe we were then, or maybe it's just highlighted and more out there now. But it's definitely something I've noticed really increase, at least in my personal experience, the last few years.
I would say probably in the first 18 or so years of my career, I worked at 2 practices that there was not a lot of turnover. But I think that's also because we were treated really well. We were
Right.
respected. We were
Right.
our opinions were valued. And I don't know if it's just because since I've moved down to North Carolina, I've worked at a corporate practice, I've worked at another referral practice. I don't know if that's the cause of it, or if it's just the timing of things of when I left those 2 practices up in New Hampshire down here, that there was a shift in what we saw in the practices. And just speaking on turnover itself, some of the roles that I've had have been like training and education and getting new technicians up to speed. And one of the jobs that I've recently left within the last couple of years, I left that job because I was hired as an education and training coordinator. And to me, that role meant I was going to be training staff. I was going to be putting on CEs, and that was like my dream job of training and CE and teaching students, or not students, but teaching new technicians how to do some of the great stuff that we can do as technicians. And maybe a couple months into that, they were like, "Yeah, we need you on the floor." So my role from education and training went from that to, well, now we need you on the floor, and by the way, we're short staffed. So there was no opportunity for me actually to do any of that training. And we get in all these new people, and me as the training person, when do I have time to do that when I'm swamped with ERs and swamped with the ICU? Like, when do I have time to do any of that stuff? And I think that probably led to a lot of the turnover at one of the practices I was at, because they didn't feel like they were taken care of, because the person that was supposed to be taking care of them was under 4 or 5 ERs and 6 triages and an ICU full of patients. Like, what was I supposed to do?
Yeah.
And eventually that's why I left, because of like, you hired me to do your job and you're not letting me do the job. So I have to find something different.
I think we have almost it seems almost like a self-fulfilling prophecy, or like chicken or the egg situation, where it's like, I kind of mentioned feeling like steeled against that turnover because it breaks my heart every time it happens, but I feel like I know it's going to happen for various reasons. And I think that's a problem. I almost wonder, like I said, the self-fulfilling prophecy of like, they're gonna leave anyway.
Right.
So tell me more about I stayed at this practice for a long time because we were paid and we were respected. Like, what was that like? What do we need to be doing differently to not have this continuous cycle that is clearly, dysfunctional for everybody?
Right. Yeah. It's a really excellent point you make, because I mean, I believe sometimes that's the mentality. Like, they're just going to leave. Like, we know that shelf life, quote unquote, of technicians is 5 to 7 years. So why make an investment to try to make that, to extend that shelf life? And Dave, you can talk about this too, but the clinic I worked at in Southern California, I think I was there for 12 or 13 years before I moved to New England. It's where I got my VTS. If I wanted to go to a conference, I just asked the practice manager. She sent me, basically all expenses paid. Doctor came out of the room, wrote the orders. We did everything. There wasn't, which I thought was pretty standard. And I would see posts online about, the difficulties people were having in clinics. And I was like, man, I'm not experiencing this. And then I came to realize I was actually working in one of those unicorn clinics that everybody kind of talks about. So they do exist, but at the same time, like, how do we break that cycle of, just getting getting, whether it be practice owners, practice managers, corporations, whoever it is, out of that mindset of, well, they're only going to be here for a short time, and into the mindset of, well, if we invest in them, like any good investment, hopefully it will pay dividends down the road, and we can extend that shelf life by a few years and have a really great team together, or a core group of people for 6, 8, 10, 12 years or more. If you create the environment that people want to stay, they'll stay.
Well, and just to jump off on using the term unicorn clinic, I too worked at a unicorn clinic, and Jeff, a lot of the people that work up there as well. And you ask what creates that unicorn clinic, and thinking back, it was like Jeff said, using us as technicians, using our skills, and valuing our opinions. And I've been thinking about this of what makes it a unicorn clinic. And when you go to a new place and you're doing your working interview and you talk to the technicians and you're like, so tell me about this place. What do I need to know? And as I'm thinking of my unicorn clinic, I would tell them all the great things about the clinic and everything about the boss. Like, the boss is a great person to work for. The office manager was a great person to work for. It was a small clinic. We were kind of like a family, and that was a great environment. And now that I think of other clinics that I've worked at since then, I say, well, this is good and this is good, but here's the other thing. And when I think about that unicorn clinic, I never had a but. There was never well, you do have to watch out for this, and so is a crazy person, and don't deal with that person. And as I've gotten into other clinics, there's always that but of like, oh, this is great. You'll learn how to do this. You'll learn how to do that. Pay's not that great. Sometimes the office manager is kind of crazy and makes you do stuff. You do have to work a lot of overtime. But overall, it's a great place to work for. With that unicorn clinic, you never have that but. You
never
have
had a but.
that thing where you're like, well, maybe. And I'm trying to think right now, like, is there something that I can think of that I would say, well, you do have to watch out for this, and I can't think of that.
Yeah.
Which is what makes it a unicorn clinic.
Yeah.
Do you think there's a scale issue there? You mentioned that it was a really small clinic and you are kind of like a family. Do you think as they get bigger and bigger, maybe we run into more problems there just by the nature of more people working together in the same environment?
Yeah, I don't want to talk bad about corporate practices, because I do see their value. But leaving New Hampshire, I came down to work for corporate practice, and when I eventually left there, one of the questions I had for my new job was like, how many levels of management do I have to go to get something done? Like, I use the example of a syringe pump, where we were short syringe pumps, and I had to fill out a form, and then I had to go to a committee, and then the committee had to talk about it, and then the committee had to pass it on to another level, and then go up to another level, and then finally 6 months later, I get my syringe pump, where 6 months later I probably need 4 syringe pumps now. So that smaller scale, I think, does play a big role in it, because the doctor there, the owner and his wife knew everybody, and they treated us all like family. Whereas in the corporate practice I worked at, when I was leaving, they said, we want this to be a family. And one of the arguments against that was, well, you just fired like 6 of my brothers and sisters, so I don't see how we're supposed to make this a family unit when you're just lopping people off willy-nilly, for finances.
Yeah. And Dave, the clinic I came from is a little bit different model than yours, in that we were owned by a board and just had a practice manager on site and had associate veterinarians. And but what I will say, kind of listening to your response, what I thought of is we had really strong leadership. If as you were alluded to with the syringe pump, I mean, if something broke, centrifuge broke, it was either fixed or replaced the next day. The centrifuge that we had in the ER at Tufts still has, I mean, the white tape has been changed, but it's been held together with a piece of white tape my entire time there. And why? Why is that? Because exactly what you're saying is that, it's got to go through all of these people and all of these different things. And it just, the wheels turn, but they never go anywhere. And so, thinking about scale, I think those were smaller practices, but certainly not, at least my clinic. I mean, we had probably 20, 25 people, maybe even a few more on staff. But I think one thing, especially as I think about like 24-hour facilities, places that never stop, they never get a break. They never get to close their doors, turn the sign around, turn the answering machine on. Like, I think it's really, really hard for those kinds of places to, if there's a fundamental problem, if there's something that needs to be fixed staffing wise or whatever, I think sometimes it's really, really difficult to get a hold of because there's never a pause button.
Well, and just I don't mean to keep going on and on about this clinic that I worked at. Was one of the things that happened that is such a stark contrast from working for a private practice and working for a corporate practice. There was one day that I took a phone call from a client and the boss was working along with us. So he was there that day. And this woman was going on and on about, she was just yelling at me. She was swearing at me. And the boss was sitting next to me on another computer. And I said, Kevin, can I hang up on this woman? And he didn't ask what was going on. He said, yeah, go ahead, hang up on her. Because he knew that if I was asking that something bad was going on. And he did not tolerate clients treating his staff that way. And he said, if they come back, we'll deal with it. And contrast to that, in the corporate practice I worked at, we had this one client that was terrible to the receptionist, terrible to the staff, terrible to the technicians, not to mention his dog was a jerk. And he had all these demands every time he came in, and he demanded special treatment. And he was a nightmare to deal with. And turns out this person was actually a life coach, which made us think, how is this person a life coach?
That explains so much about
can't control his own life and gives us all this crap. And thinking back to the clinic that I worked in New Hampshire, that person would have been fired as a client like instance number 2. And this was going on years of this person being terrible to staff. And there was an actual meeting to say, should we fire this person, and pros and cons? And there was like, I don't know, there was at least 10 people at the table, like doctors, technicians, managers, CSRs, all that stuff. And I'm like, and this is very early on in my corporate career. And I said, guys, I'm not really understanding this, because in the clinic that I used to work at, we would never be at this state. We would never get to the point where we have a meeting on whether or not we're going to fire somebody. And I gave the example of somebody called and browbeat me over the phone about something that was completely unrelated, and the doctor said, "Go ahead and hang up on them." Whereas here, we have to have a meeting on, are we going to tolerate this person treating the staff this way? And I don't mean to place such a emphasis on how bad corporate is and how good private is, because I do realize that both of these things have their value. But just making that a unicorn clinic is taking care of your staff and having their back and being on their side, instead of saying, well, this person's being terrible to all of us, so let's talk about it first before we get rid of them. And I'm trying to think. I don't think they actually fired that client.
Yeah.
Which,
oh my goodness.
I mean, kind of goes right along with it.
Right.
Yeah.
Right.
Dr. Cassi, kind of along those lines, like, did you have any training in school about how to deal with how to navigate those kind of situations as a veterinarian? Like, what do you do if you're in the situation with an irate client? Like,
Conflict resolution.
Yeah.
Yeah.
Do you felt like you got a little bit of that or no?
So, yes and no. We did have some training just on client communication, and they would kind of walk us through talking to a client. If I'm remembering correctly, it was like, we did this a couple times throughout a semester. We did, and kind of periodic trainings. It wasn't, like, if I don't want to speak incorrectly, but I feel like it wasn't like a whole big class on how to do this. And I think a lot of the focus was on our communication with the client, not necessarily vice versa. Not
Gotcha.
like, what do you do if the client comes back at you and is irate and is creating this big situation? More so like sitting in an exam room with a video camera, and are you asking open-ended questions
Sure.
and stuff
Okay.
like that.
Sure.
So no, we went through some stuff on, what if you make a medical mistake and communicating that to a client correctly. But I don't think there was a lot in terms of conflict resolution. And I I feel like I'm hearing a lot more stories now, 2020,
Yeah.
of just these really difficult clients being a more regular encounter. I don't know if it was quite as pervasive.
Yeah.
I graduated in 2014, which wasn't a super long time ago, but in 2020 seems like quite a big departure. So maybe these are a little bit more pervasive now, but I don't know. That could just be my
Yeah.
perception.
Yeah. Yeah. Could be.
Well, and just, I mean, you mentioned 2020. I mean, added stress. I mean, it's stressful for everybody, but us as essential employees or essential workers or whatever they're calling us, we don't have the ability to say, okay, well, we're just going to take a break because COVID's going on. We still have to go to work. We still have to do all this stuff.
Hmm.
Yeah. Yeah. Cassie, you brought up the point a little while ago, and it's something I kind of want to go back to because it kind of feeds into a lot of this stuff. The difference between or the usage of correct titles like veterinary assistant versus credentialed technician, and as I said, even in my time at Tufts, I saw assistants promoted to veterinary technicians who had not gone to school or had not taken the VTNE or satisfied the Massachusetts requirements. And again, I think that's, even though the school isn't necessarily going to spend time training veterinary students on what an actual CVT is, kind of as an unintended consequence of that, they are training veterinary students that it's okay to hire veterinary assistants and call them veterinary technicians and so on and so forth. And, I was an alternate route student in California. So we basically had this law that you could, if you had enough in clinic experience, you could combine that with a lesser education component. You still had to go to class, but it was less classroom hours. Combine that with your experience of a couple of years, and then you could take, at the time, it was California did not have the VTNE. We had our own state exam. So I went that route, and then we adopted the VTNE a few years later, and so I have taken that. But as an alternate route student, there's still probably 36 states in the United States that I can't get licensed in, even though I'm a CVT in Massachusetts, I'm an RVT in California still, but I can't get licensed in a number of states because I'm not an AVMA accredited school graduate. But there's so much variability there, just in our own profession in terms of title, but the delineation between the two, I think, is really starting to. I mean, it's been kind of rolling for a little while, but I think that debate is, or that idea or that discussion is really starting to heat up about appropriate title usage. And I think, again, that feeds back into pay, that feeds back into utilization, that feeds back into turnover. So many things we've been talking about, but I think that's another facet of it.
I think that's a big problem with this. We look at this whole technician thing as a big issue, and there's so many different facets to it, like we've talked about, but we typically can't fix one without fixing another, and we can't get to the goal without fixing all of them. There's not a way to fix. I don't think there's a way to fix one individual thing. They're all interconnected, and it's very hard to do all that.
Yeah,
I think
agreed.
that's one of the big problems with this.
Yeah.
Yeah, my husband and I were having this conversation yesterday, and I was talking a little bit about our conversation and some conversations I've had recently, and we were trying to solve all the problems. And you're exactly right. Sure enough, as soon as we solved one, it created another one, and they are all interconnected. It seems like to me that um, if we're going to change anything, we we need to do it, and it's going to be painful, and there's no way to move forward in a way that's going to address these issues that isn't going to hurt in some way. And so we kind of just need to know that that's going to happen, and go forward anyway and try to make things better for everybody. And as veterinarians, we need to be an ally. We of course have stake in these issues, but we want the people that we work with to have job satisfaction and longevity. And so, how do we help? How do we do good things? And I think you guys have hit on a lot of good points as far as utilizing technicians. And I will say that's an area that is very important to me. I really like my staff to be involved and not to feel like warm bodies or glorified animal holders. But I also don't want to cross that line of like, well, isn't this your job as the doctor? And so that can be a tough spot to be in as a vet of like, oh, if I ask this
Yeah.
person to do that, are they going to think I'm trying to like shirk my responsibilities? Um, and I think where I've gotten with, in my roundabout way of getting there is a lot of communication on all sides.
Yeah.
DVMs, credentialed technicians, veterinary assistants, practice managers, and getting everybody's thoughts out on the table and trying to move forward, even just with baby steps.
Yeah.
We're not going to make huge leaps forward right away, but we can't just stay stagnant because there's no easy way forward.
Absolutely. At some point we have to rip off the Band-Aid
Right.
and just go for it, and hope we get it right and what have you. But you brought up a good point there about utilization and what have you, and keeping that conversation going. And sometimes I think almost you have to inspire your staff to, or your coworkers or whoever, to want to do new things. Like we get comfortable knowing what we know and doing what we do, and that's a comfort zone. And sometimes like we have to push past that boundary a little bit and say like, I really think you can do this. Like let's try it a couple times. And just again continuing to like build our groups up, build the collective group up, and keep pushing forward. And every clinic is always going to operate a little bit differently, but again, if you have good communication, you have a good structure, you have good people, like continue the investment and continue forward. And as we talked about, like knowing what is allowed in the state in which you live in terms of what technicians can do or can't do, whether that, maybe they can do dentistries, maybe they can pull teeth by law, maybe they can suture incisions or do different things. Like some states that's really clearly defined, some states it's really not. And what maybe where those gray areas lie, and then what your level of comfort is. But I encourage anybody listening, like know your state laws, know where responsibilities lie and what people can and can't do, and work within that framework. And I think you will start to have a much, much happier staff, probably even a much happier clientele, because things will run more efficiently. And we move that stone a little bit more in that direction, one little bit at a time.
Yeah, and just touching on the utilization, I've thought about what makes a good team, and that's where all the team members are all working towards the same thing. And so often, I've worked in, and Jeff, you've worked in very busy ERs, and you've got 3 patients, 4 patients, 5 patients lined up that all need catheters, all need IV fluids, all need X-rays, and kind of going on the opposite side or contrasting what we've been saying about tech utilization is that if we have that situation, and something that really makes me feel like I'm part of a team is when I get done with one and I come back and I say, okay, let's get started on the next one. And then I find out that, oh, Dr. Jeff has already placed the catheter. He still needs help getting the fluid set up. But being part of that team, obviously we want as technicians to be able to do all this stuff, but there are going to be times where we don't have time to do that all in a timely fashion. And just getting doctors to understand that, yeah, they're going to be giving us all the orders, and sometimes they give us orders for 2-3 patients at a time, and not realizing that all these things do take time, and sometimes we do need help because historically we're always short staffed. But just having doctors be a part of the team instead of just being the ones that say, okay, here's your orders, I'm going to go sit at my desk and type up records. Being involved in that and understanding that sometimes we are swamped to the point where we can't get the stuff done that you want us to get done. Obviously don't take away stuff that normally we can do, but if we are swamped to the point where we can't get stuff done, getting someone to step in and help out is just super helpful.
Yeah.
And it makes us feel like we're part of the team. And when I've had doctors come in and say, I'm going to place this catheter, or give these sub-Q fluids, or do this while you're doing all these other things, never am I going to say that's my job, I should be doing that. Because if I'm swamped to the point where I'm backed up, I mean, that takes stress off of my mind of just having help. And making us feel like we're part of the team, and making us feel like the doctors are part of the team instead of, I don't want to say it's an us versus them, but having it be that dynamic of doctors are the bosses and technicians are the subordinates. Having a team cohesive unit, I think, is really helpful.
Yeah.
And there are a lot of doctors that do actually do that for us, which is really helpful.
Yeah. Agreed.
I'm so glad that you said that as far as like being part of a team. So I heard a couple things in what you said. It sounds like ultimately it's a balance. It's a balance between letting you do your job, but not when you're so swamped, not failing to jump in when the technical staff is so swamped that they can't get it all done, still being willing to jump in and pitch in. I will tell you, I could not agree more with you as far as the team approach. I feel so strongly about that, and everybody looking at this patient, looking at this case, and offering their opinion. One of my biggest pet peeves is if I say, hey, what do you think about this? And somebody looks at me and goes, I don't know, you're the doctor. I'm like, so I automatically have all the answers? Like, no, I'm only one person. I'm only human. I've been a vet since 2014. So, 6 years, a little bit over. You guys have been in the field for 25. You've worked with multiple different doctors, and you've seen lots of different cases and different approaches to things. There's a lot of value to be gained from that team approach and just everybody putting our heads together and coming up with the answer together. We get better patient care, we get better client service. And then, the other part of it too is if there is that team approach and everybody's involved, it frees us up as veterinarians because that client doesn't always come back needing to talk to the doctor. They just want to talk to a team member because they have faith in everybody who's involved in their dog or their cat's or chinchilla's care. So having that team, I don't, not personally with me. I would definitely be one of you guys that would have the care of that one. But no, I just think it makes life better for everybody if we all work together in that sense.
Well, I've had doctors do that thing of like, what do you think? And I'll say what I feel, or, give my opinion of what I think is going on. And if I'm wrong, I want them to tell me, no, it can't be that because the heart rate isn't elevated or something like that. Use those things as learning experiences. I mean, you as doctors are looking for answers. You're trying to figure stuff out. But as technicians, that's going to make us smarter and more part of the team if you include us in those decisions. Ultimately, the decision is yours, obviously, but to just have us use our brains to say, oh, I've got an elevated heart rate, I've got an elevated temperature, maybe this dog's in pain, maybe it is in various stages of shock or what have you. But just being able to utilize our brains, because I mean, granted, Jeff and I have been in the field for quite a long time. We have a lot more knowledge and experience, but even those younger technicians, if they've got even just a little bit of experience, they can kind of talk their way around things and figure stuff out. And if they're wrong, that's a learning experience for them. We've always said that being a technician, once you get through school, once you get your VT&E passed or your VTS passed, you're not done. There's still tons to learn. I often tell my students and my coworkers, I'm like, I don't know anything. I don't know everything. That's not a myth. It's a myth you need to stop telling people, because there's so much more knowledge for us as technicians and even you as doctors to learn stuff. Like I feel like every single day I go to work, I should learn something.
Yeah.
Yeah. And I will say, even if we ask for an opinion and it's not on the right track, what I've found is, even if that's, completely not where this case is going, it gets my wheels turning in a different way. So it changes my perspective on the case. So even if that's not the answer, it still helps me get to the answer by just changing my perspective on what I'm seeing. So I think there's a lot to be gained from that roundtable discussion and everybody using their brain to figure out an animal, not just, oh, well, you're the doctor, so you have all the answers. Because I promise you that's not the case.
One thing I've heard a lot through the years, especially about technicians, and maybe this applies to veterinarians as well, is that once we have acquired a certain level of either, whether it be knowledge or skill level, we hoard that. Some of us hoard that and don't pass that on. Don't teach or keep things to ourselves, almost as like a job security kind of thing. When you have this team idea, if you have 6, 8, 10 people, whether it's one veterinarian and a bunch of staff, or a bunch of veterinarians and a bunch of staff, kind of problem solving this case, so many different people have so many little different areas that are their niche, that this person over here might be like really, really strong and really love dentistry. Somebody else might really love ophthalmology. And like, you can really lean on those people and not have to have one person have all of those areas. And so, I know, again, like I said, it's been kind of long out there that some technicians, and I'm sure, again, this applies to some veterinarians as well, that we just kind of hoard our knowledge and not, whether we're embarrassed to share it, whether we don't want to share it, but share it, allow it to become common knowledge, so that the next time that thing happens or that case comes in or what have you, everybody is better prepared for it. And then you can, start to problem solve with other things that maybe you couldn't figure out, because it doesn't matter your credentials. It doesn't matter how much school you had. Like, if you have valuable contributions, make your voice be heard.
I am opposite of hoarding my skills. And I'll tell a story that happened recently, within the last couple of years. Is I really like transfusions. I really like setting that up and figuring all that stuff out and doing all that stuff. And I was fairly new at this job, so I was coming in with a lot of knowledge, and a lot of the technicians that I was working with didn't have a whole lot of knowledge on transfusions. They just kind of followed along with what the doctor told them to do. And then I come along with all this passion for transfusions and knowledge about it. And I got a call at a baseball game, day off at a baseball game. Dave, how do I do this transfusion? So sharing that knowledge, not hoarding that knowledge, gives me the opportunity to not have to be on call all the time for all those things.
Yep.
Happens with central lines too. Like I've worked at some clinics where I would come in the next day and we've got a DKA patient that didn't have a central line in, and they're poking it every 2 hours for a blood draw. And I'm like, why does this patient not have a central line in? And they said, well, nobody knew how to do it. I'm like, well, why does nobody know how to do it? Why didn't somebody ask me to show them how to do this? Because this patient would have been so much better off with a central line in it than you poking its lateral saphenous vein every 2 hours for the last 12 hours. So I am against hoarding skills and knowledge, because the more you spread that knowledge and the more you spread those skills, the less I have to do.
Right.
Mm-hmm.
And not that I don't want to do anything, but there's a lot of things that I do in my role. And if I have to stop X, Y, and Z that I'm doing to do the one thing that only I know how to do, like how is that benefiting?
Right.
I mean,
And it benefits everybody, like having that knowledge out there. It benefits the patient, it benefits the client, it benefits the team as a whole. And like you said, and it benefits you personally, because it takes some of that burden off of your shoulders.
Yeah.
This job is a huge responsibility. There's so much to do all the time. There's so much on all of our shoulders all the time. Like, spread it out, spread the load.
Yeah, for sure.
Going back to the team.
Right.
I think the whole scenario of this entire discussion should be teamwork.
Mm-hmm.
Like that's the only thing that's going to get things done is teamwork.
Yeah. So ideas, how do we make some of this stuff happen?
Oof.
Well, I'll say one thing that I've heard in this is, I kind of mentioned earlier that it can be painful to make an investment in somebody, because there's this kind of, the lifespan typically in the veterinary technician field, to say like, oh, I'm going to, pour my heart and soul into this person. And they're not only going to leave my clinic, but they're going to leave the field entirely. And that can be hard to do. But it sounds like we need to make that investment anyway, emotionally, time, knowledge, financially, and make that investment in people, because we're still going to lose people. People are still going to leave the field. We're not going to change it overnight.
Right.
But if we can get a few more to stay in and a few more to stay in, and then maybe we can start improving things as a whole, then maybe we can change that narrative in the long term.
Absolutely. And, I think we've probably all heard in 2020, with everything that's going on, seemingly clinics are busier than they've ever been. Everybody is being pulled 12 different directions at one time. Their caseloads are up. I have a real hard time believing that clinics are not making at least as much money, if not more, than they previously have. Actually analyze your income and see if you can make an investment in your team. And that includes yourself. If you're the practice owner, if you are, if you're the practicing veterinarian, whatever it might be, like that investment includes yourself. And I would be hard pressed based on what I've heard about how busy clinics are. And I can certainly think of my time at Tufts. I mean, we absolutely were. But yet it seems even with as busy as clinics are, we're almost paring down or minimizing resource utilization and holding on to money even more than we previously have. And why? Like, all that is doing is really furthering the problem and not working on a solution. So I would encourage people to really look at, if you really believe you're busier this year than you ever have been, then you should be making more money than you ever have been. And if you are, what are you going to do with that? Because that's going to speak volumes to your team. And even if that's, whether that's investing in new equipment, replacing old equipment, technicians get a huge rise out of a new piece of equipment to play with. Yeah. Same with doctors, like a new, a new surgery tool, an upgraded phone system, like whatever it is. Like investing in the practice is not just investing in the people; it's also investing in the infrastructure of the practice. And so, kind of like look at that as well. Bring yourself up, get new blood machines, whatever it might be. There's a number of ways to do that, but I feel like if you actually can say you feel like you're busier than you ever have been, you should have more disposable revenue to invest in your practice and invest in your people and invest in yourself.
Well, I think we also, in order to stop turnover and increase retention of technicians, just speaking on technicians right now, but just thinking about how to keep good technicians in your practice, is you have to incentivize it. You have to say, okay, you're going to start out at $14 an hour. And if you complete this task, and you show us that you're going to be working your way towards a leader, then we're going up to $14.75, and have a clear path of that. Not right. You're going to get raises potentially after every whatever it is, the first 90 days, we'll talk about getting you a raise. Have a plan in place. Don't just dangle the term raise. You're going to get an increase. Great. Yeah. What is that? What am I working towards? And then suddenly you get an increase, and let's say it's like a 2% increase. So now you're making $14.25. Great. Awesome. I made another quarter an hour. But incentivize that and put a clear path for technicians of, if you stay here this long, this is what's going to happen, and this is how you're going to benefit from staying that long. And not just money, not just financial incentives, but days off. I mean, yeah, and days off, and forcing, I don't want to say forcing, but requiring that people use them, because, and then here we go. This is going to circle back around. We have to fix that by, we can't tell people to take off when we're short-staffed every single day. Like, how are we going to say, okay, Tiffany can't work today because she's got her scheduled day off, which means that only one person is going to be on the floor today, where normally we're going to have three. So you have to incentivize it in a way that's sustainable and mapped out. Yeah, I feel like, here's what you're going to get year one. We're going to increase your pay to such and such, like an extra $1 an hour if you complete all these tasks and show us that you're working your way towards this goal. Instead of just saying we're going to give you an increase at some point. Like, right. That's great to hear, but then when I hear that, what am I going to say? I'm going to say, okay, when is that going to happen? Right. What do I have to look forward to? Right. And I will say, even going back to the unicorn clinic that I worked at, there was one year, as I was getting further and further on, they said we've had kind of a down year. I can't afford to give you a raise, but what I am going to do is I'm going to pay for all of your medical insurance this year. So just doing the math in my head, like that paid for a raise. That's less
Right.
money taken out of my paycheck, and it probably worked out, tax wise with the owners. But instead of saying we don't have money, sorry, we'll try next year, he did something.
Right.
He did something to show value and show that there is a path for me. There is something for me to work towards. And I feel like if I was still working there, I'd probably be making $4 or $5 more an hour than I am now.
Right.
But I hate snow. That's why I moved to North Carolina.
I'm with you there.
You bring up a really good point, Dave, because I think when I was younger, when I think back to my early days as a technician again, $5 an hour. At that time, 16, 18 years old, all I really cared about was what my paycheck was.
Yep.
Now at 42, and knowing that, from a pay perspective, we're largely topped out in this profession, I care less about the dollars per hour and more about the benefits. And so as you were kind of alluding to, having like some kind of tiered setup where, as you reach certain benchmarks with a certain practice, at 5 years, we are going to increase our match 401k from 2% to 3%. At 7 years, it goes from 3% to 4%. Like after your 5th year, you get an extra week of paid vacation. After your 7th year, you get, have those kinds of things set up that actually make people want to stay. Because frankly, the reality is, at some point, $1 an hour for a year, that's $2,000 gross. That's not going to make a difference at some point, being the only thing keeping people there. There's going to have to be other things, and that's going to be benefits. I've seen hospitals offer gym memberships. I've seen hospitals offer, supplemental insurance like Aflac, like really outside of the box things. And when you can't really put a dollar sign on some of that stuff, but as you said, like in a year when maybe things are down and they can't offer you that raise, if you happen to hit a milestone that year, if that's your 5th year or 7th year, and you get an extra week of paid vacation, or you get some extra PTO or whatever it might be, like that's ultimately, especially as from my perspective, as you advance in this career, that's what's going to keep people long term, not $1 an hour raise a year. Like, yeah. It's how are you going to be set up for the rest of your life, and offering 401k and offering, some of those kinds of more long-term goals, to me now, 25 years in, is far more important than what, I used to think about just a paycheck back then.
Yeah.
Kind of treating people like they're going to be in the field for a long time.
Right. Yeah.
Right. Setting up a plan that is conducive to longevity.
Yeah. One of the veterinarians I know from back home, I worked with him in emergency, and he opened or bought a general practice, and it's a thriving general practice. Like it's a really, really, really great facility. And he was one who really invested in his staff. But for every staff member that hit 10 years, all expense paid vacation to Hawaii.
Oh my gosh.
And now granted, that's a very extreme example, but he knew what the value of having people in that practice that clients saw every time they came in, the same faces, the same voices on the phone. He understood the value of that. And, I remember a couple of years ago now, his practice is probably only, I'm going to say 15-ish years old at this point, but he's already sent 3 people to Hawaii.
Wow.
And that's like, again, that's an extreme example. Not everybody has that budget, but that's something that is going to keep people, like if you're at 7 years, like, man, I'm going to hold out 3 more years and go to Hawaii before I leave this place. Like whatever it is, like, and again, you don't just have to do that for yourself, do for your staff, do that for yourself, like incentivize yourself as well as a practice owner or a practice manager. Like, anyway. Yeah.
Well, and also just thinking about the structure and the levels, a lot of the practices that I've worked at, they have like, you start off, you get 40 hours of vacation time. If you're there for 2 years, it goes up to 80 hours. Then at 5 years, it goes up to 3 weeks off. And then after that, usually there's nothing. because they don't expect us to be there that long.
Right.
They haven't factored in that if your practice is great and people want to stay there, you may have people that are there for 10 years that want to do some of that stuff. Like I can count probably on one hand the number of technicians that I know that have been in a practice more than 10 years.
Right.
A couple of them have been on our show, and a couple that I've actually worked with the general practice I worked at. There's a couple technicians there that have worked there 20 plus years. But that's so rare. It's not very
right.
It's not very common for technicians to be at one practice for that long.
Right. And I think about my time at Tufts as well. I mean, I was only there for 4 years. I frankly, especially at this point in my career, I couldn't see doing it long term. But there are a number of people that have been there either approaching or past 20 years as well. And I know it's not the pay. I know it's the benefits. It's the academic calendar, and it's working for the university and all of the benefits that has come associated with that. And again, at some point in everybody's life and everybody's career, like it kind of starts to shift a little bit more that direction. And, again, incentivize it. At 3 years, we're going to pay this much of your health insurance. At 5 years, we're going to pay this percentage. And again, I think that is exactly the type of investment that I'm talking about. Like, why is 5 to 7 years the shelf life? Because Dave, as you just said, most practices only have plans in terms of a tiered system for 5 years.
Yep. Mm-hmm. Well, it's hard to plan for something that long when, like we've said, you've got 2 people there that have been there 20 years. I know maybe 3 or 4 other people that have lasted longer than 10 years. It doesn't really make sense for them to make that plan because, it's going to happen once or twice ever, right?
Right. But that's just, I think that's just having the hope or having the desire for that to be the system. Have a plan in place. If nobody ever hits it, nobody ever hits it. But
but we talked about the self-fulfilling prophecy earlier.
Right. Absolutely.
So change the narrative, make a different self-fulfilling prophecy, and act like people are going to be around for the long term. And you won't get everybody, but maybe you'll get some.
Yeah.
Well, and then that that practice you talked about, Jeff, that's the practice that sends technicians to Hawaii. Right. So that is something that, right now I'm like,
that's a good job to get.
I think I could.
Yeah, that's a good job to get. Like,
sure, you get a reputation out there for being somebody who takes care of staff. Yep. I'm so glad that we're putting all of this out here. Like, I was just sitting here listening to you guys talking, and I'm like, man, I feel like, I've got the cheat sheet here to hear a lot of what's going on and causing a lot of dissatisfaction in the field. And so I'm glad that we're going to be putting this out there. Everybody needs the cheat sheet, or at least the beginning version of it, to say, we've got something we need to change. I think that there's been enough conversation in various aspects to say it's not going to be simple. It's not going to be easy. Like you said, we fix one thing, we break another. So we're just going to have to break some things, and let's break some small things in the beginning.
Right.
But let's start moving forward, because now that we've pretty much come to the conclusion that it's not a simple fix, then we're just going to have to start doing something.
Right.
So thanks for giving me the cheat sheet on all of this stuff. Tell me more.
Well, the hard part of this is that we're technicians. Like, we're underpaid technicians. We don't have a big stake in the game of how to change these things within large corporations and large practices. And it's just getting a voice out there and getting more than just us to be on board with this, to kind of push this conversation forward.
Absolutely. And I think, for some of these things, Cassi, you said earlier, you used the term, veterinarians need to be allies for technicians. I couldn't agree more, because a lot of this change, at least for our profession, is going to have to come from the AVMA, where veterinarians are the only ones with seats at the table, because a lot of this is going to have to be national movements or national rules changes, legislation, and obviously not the financial stuff, but in terms of titles and different things, like, we are going to have veterinarian alliance to work with their agency, the AVMA, so that we can work with our agency and NAV to really try to make some of this stuff happen. And again, I know this stuff doesn't change overnight. Like, the wheels of government turn very, very slowly.
Especially now.
But
Yeah.
I mean, I feel like, Dave, the episode we just recorded with Liz Houston, she said she felt for a while like that something big in the veterinary industry was coming. And I mean, I really think if we're not already there, we are rapidly approaching a critical mass in this field. And we need to take action. And it's going to take, new ideas, new people. It's going to take, people getting out of their comfort zone and taking a role in some of these things, or being active in some of these things. Like, honestly, who wants to go to AVMA board meetings? But you know what? They're public. You can attend. When I lived in California, I go to every California Veterinary Medical Board meeting, and a lot of times it's like literally watching a car fire on the highway, and nothing gets done. But that's how we move the profession, like 1 degree forward. Like, show up to the meetings, share your ideas, let your voice be heard. And I get it. Like, it's boring, it's a day, it's whatever else. But if we don't have the conversations, nothing is ever going to happen.
I agree with you about the critical mass. And I don't know exactly what that's going to look like. I don't know if we're here and this is what it looks like, or if there's something more coming. But there's a lot of just difficulties in every aspect of the profession for a lot of different reasons. And I think things that we can improve on going forward. And it's not going to be there's nothing where you can say, oh well, we're going to change this and this and this and this. But maybe we're getting to the point where we can at least start having these conversations and everybody come to the table and be honest about where we're at with things in order to better the profession as a whole and keep moving forward, not just stay stagnant in that, well, it's always been this way. You just gotta work yourself to death for no
Right.
money and
until you can't take it anymore. Yeah.
Right. Until you leave the field.
Yeah, absolutely. Absolutely.
I wonder if we could have, like, I mean, this is, I know we're talking about baby steps, and I'm thinking huge, massive picture. I wonder if there's some way, and it may have to involve NAFTA of some sort, of just having a roundtable discussion or a meeting of technicians of the technician field, and have representatives from every state, different regions of the state. I want to say like a Congress, but like a group of technicians that are part of organizing and making these changes. Like, how do we organize and get to the point where we can go to the AVMA, go to these different entities that are going to be controlling some of the things that we're trying to create change with? How do we get that organization to get a clear path of what we want? And we talked with Liz Houston about unionization, and I don't know if that's involved in it, but how do we get on a national level some of these ideas out to the people that are capable of making the change? We're just talking about it. We're starting this conversation, and I don't know if it's just, I don't know what's the term, imposter syndrome. I don't know if it's just imposter syndrome, thinking that I'm just Dave. What can I do to make all these changes? Like, how do we get to a bigger level to make these changes? Like, where do we go from here? Yeah. Like, we're getting these ideas out. We're talking about them. We're discussing them. But how do we get them to the next level where change can actually happen? That's my big question.
Yeah. Yeah. And it's one I don't have an answer for.
Yeah.
No. I mean, I'm thinking, something along the lines of the Veterinary Technician Association and stuff like that. But you guys would know a lot more about that than I would. The other thing I think is we need to be realistic about our expectations in veterinary medicine. I mean, there's no doubt that many of us who go into this field and we're in it for the long haul, there is some sort of a calling, or whatever you want to call it. Our hearts are in this field. Personally, for all of its flaws, I love being a veterinarian. I love being in veterinary medicine. But I also think we need to be realistic that we can't just all show up out of the goodness of our hearts for the rest of our careers. We have families to support and bills to pay, and we want time to ourselves to do things outside of veterinary medicine. We want to have hobbies and lives and stuff like that. And so instead of kind of taking for granted that, oh, well, it's just this calling, and veterinarians and technicians and everybody alike are just going to continue to show up no matter what because we have this calling, it's not realistic for the long term. And I think we're seeing some of that now.
Yeah.
And so getting that message across of, yes, of course, there's a part of it where our hearts are in it, but we still have to make it a sustainable career field.
Right. Absolutely. Well,
did we solve it? Did we fix all the problems?
I'm ready for another 25 years.
Jeff, another 25.
Oof.
Like you said 10 years and I get to go to Hawaii. I'm like, I don't know that I got another 10 years in me.
Oh my goodness. No, we're so happy to have had you guys for as long as we have. Don't let us lose you now.
Well,
I mean, I think that was some great discussion. And,
it was.
And honestly, I mean, I would 3 months, 6 months, a year down the road, whatever it is, I would love to have another discussion
Absolutely.
And look at what we talked about today, and are we still having the same early or rudimentary discussions of it, or has anything actually happened? Are there any new ideas out there that we can discuss and continue to, hopefully move this thing forward? Because again, frankly, like I say this partially tongue in cheek, at least, I feel like, at 25 years, like in terms of clinic work, my best years are behind me. I want to leave it a little bit better for them coming along. I didn't really recognize many of these problems until I hit, year 15, year 20, whatever it was. I'm hoping that people that are getting in there now, in 10 years, if they make it that long, or 15, that it's better than what it is now. We've kind of somehow gotten to this point. Hopefully we can get it a little bit better so that our respective professions, both for DVMs and for veterinary technicians, it's better. Some point down the road, it's just better.
Well, and just putting this information out there and continuing to recognize that there are these things that need to be addressed. I mean, it's 2020. We have technology and social media, and the world has shrunk around us, in that we can reach out and communicate with each other. Right. Hopefully just, continuing to put that information out there will engage more and more people to where we can all work together and move forward.
Absolutely. And I also want to say too, as some of these discussions unfold, whether it be in podcast forum like this or in Facebook discussion groups, be nice to each other. Like, no idea is not worth discussion. Everything, whether it pans out to be a good idea or a bad idea, it still warrants discussion and thought. Like, let yourself get uncomfortable, let yourself be vulnerable, let yourself actually like think about things in a new way, because that's where change is going to come from.
Mm-hmm. Yep. Get outside of your comfort zone a little bit.
Yeah, absolutely. And
I'll tell you, I love to take these conversations, and this one absolutely is along the same lines, and walk back into a clinic setting afterwards and say, okay, this is the conversation I had. This is what I gathered from the conversation. Where are you guys at? Tell me your thoughts on this. And there is some discomfort there, both on my part of, feeling like I'm kind of putting myself out there to, this might not be positive feedback that comes back.
All the stuff they've been wanting to say, but just haven't.
Yeah, like open the door. All right, guys, let me have it. But also, on the staff's part to say like, oh, what do we say? Like, what's safe and okay. But once we get that conversation going, I mean, just on a very small scale in a single clinic, I feel like I've had some great conversations and gotten a lot of insight from the staff just of that one clinic. And so if by putting this out there, we can open the door to say, all right, listen to it. And then just start having conversations with each other, veterinarians, technicians, practice managers, everybody. And let's talk about it and see where we all fall on the same page. Like you said, hear novel ideas, get uncomfortable, and see where it all falls.
No, and I will say that, I realize we're in, I don't know what the lockdown status is where you are, but this would be a conversation to not have at the clinic. This would be a conversation to go out, have drinks, and say, guys, let's talk. Because in the clinic, there's that thought of like, why are you asking me this here? Why Like who told you to ask me this stuff? Is there a management part of it that's wanting you to go in there? I think when you get people out of their comfort zone and out of the work environment, they're more open to saying, look, this is what's going on. Just between you and me, this is what I want to tell you. Whereas in the clinic, you may get an edited version of what they're really thinking.
Right.
I
That's
think
just
good advice.
my personal experience. That's
Yeah.
and having a couple drinks always helps to loosen
There
up
you
the
go.
lips a little bit as well.
Absolutely.
Absolutely.
Absolutely. No, I think that's great advice to
Yeah.
make sure everybody's in a situation where they're comfortable and
Yeah.
isn't looking for the catch of, all right, if I
Right.
say this, then what's going to happen?
Right.
Yeah, and then suddenly, like 2 weeks later, so Dr. Cassi spoke with us about what you said the other day, and then they're like, "Oh crap, I shouldn't have said anything."
Oh, shoot.
Right.
Yeah,
Right.
yeah.
Right.
I've actually known situations. Fortunately, I've not personally been involved in them, but I've known situations where those kinds of things have happened, and yeah, then there's no conversation
Yeah,
after that.
yeah.
Yeah.
Realizing that now you can't really just go out to a bar to
Right.
have that conversation.
Right. Right.
Yeah,
Right.
exactly. Is a Zoom beer date
Yeah, well,
something like that?
I mean,
We've
Jeff
done
and I have
that.
done a couple of those. Yeah.
Yep.
Yeah,
Yep.
yeah, absolutely. Jeff, I was looking at your sweatshirt there,
Oh.
and I have a wine glass that says, "I just want to drink wine, save naps."
Nice. Well, I've had a lot of fun today.
Yeah, this has been great.
Me
I-
too.
I-
Yeah, absolutely.
I've thoroughly enjoyed the conversation. What do you think? Should we quit while we're ahead? And
Took the words out of my mouth.
Yeah.
All right. Well, thank you so much for taking the time out, everybody, and chatting about all this stuff. I hope to do it again soon.
Yeah, we should definitely do this again soon. Probably, I don't want to say after COVID's over because we don't know when that's going to be.
Right.
But at
yeah.
some point,
But at some
in the
point,
future.
at least
Yeah.
check in and see, see what's changed, if anything.
Yeah, I
hopefully-
think that's a great idea.
That's always the
If-
plan, right? When we treat patients, right? Initiate a treatment plan and evaluate
Yeah.
patient response. Like,
Yeah.
let's
Ever the technician, Jeff. Ever the
discuss some
technician.
ideas and evaluate the response.
I love it. Well, yeah, let's definitely plan to have this discussion again in the future, and like you said, see if we've moved the needle even a little bit.
Yep.
Mhm.
Yeah. love
Awesome.
it. Cool. All right.
Thanks, guys.
Thank you.
All right, guys, I hope you enjoyed that talk as much as I did. I want to say a huge thank you to Jeff and Dave for joining me. And like I said earlier, be sure to go check out the Vet Tech Cafe podcast the next time you have a few minutes. If you'd like to find out more about this and other exciting podcasts, click on the education tab on Vetfolio's website. As always, we'd love to hear your input on this session, as well as ideas for topics you'd like to hear from us in the future. Feel free to reach out to me at dvm@vetfolio.com. You can also visit my Facebook page at Dr. Cassi DVM, and you can find me on LinkedIn. And remember, if one animal is better off because of you today, it's a great day.